My philosophy for patient care is basically a variation on the golden rule. Do for my patients what I do for my family. Simply stated, that means to look at each patient in a careful and thoughtful manner, come up with an accurate diagnosis, which is oftentimes the most challenging part of what we do as neurosurgeons, and then come up with an effective treatment plan. Oftentimes that treatment plan doesn't involve surgery. In fact, the majority of patients that see me for the first time don't have pathology or problems that would benefit from surgical intervention. In those cases, we get them set up with other modalities of treatment, whether it be physical therapy or pain management. When I was in medical school, I rotated on the neurology service and became fascinated with the nervous system, the elegance with which it's laid out, the organization, and then ended up rotating on the surgical service, and found that I liked working with my hands and liked the tangible aspects of surgery, the before and after aspects of surgery, and neurosurgery allowed me to combine my interest in the nervous system and my interest in working with my hands. My training as a neurosurgeon involved attending Johns Hopkins University School of Medicine in Baltimore for 4 years. I received my degree there in 1998, and I stayed on and completed my neurosurgery residency training there prior to moving here to Jackson in 2005, where I've been in private practice. At Johns Hopkins, I had the good fortune of overlapping my training with two of my current partners. John Davis, who finished several years ahead of me, is a native of Jackson and came back here to practice. Jack Moriarty finished 3 years ahead of me and joined John in his practice, along with Lynn Stringer. I had the good fortune of being recruited by them to join their practice back in 2005, and it was a great move. I've really enjoyed living and working in Jackson. I'm particularly interested in complex spine surgery, and a portion of that I'm particularly interested in would be minimally invasive approaches. Minimally invasive approaches involve treating pathologies in a way that's less traumatic to the body and preserves more a normal anatomy. And what I've found and others have found is that helps speed recovery and minimizes complications, both in the short term and in the long term. And although there is a learning curve to that, it's been very satisfying to get durable results with a more speedy recovery. I've lived in Jackson now for 10.5 years in the heart of SEC country. And although this may not make me very popular in this area, I'm a dyed-in-the-wool Duke Blue Devil fan, and I love watching and rooting for their athletic teams, both basketball and football. But you don't hear too many people talking about Duke basketball or Duke football around these parts.